Welcome back to AM Northwest. Gum recession is common and really can occur at any age, but now a treatment called Pinhole Gum Rejuvenation can correct receding gums with no surgery and little to no downtime. Here to tell us more, we welcome back Dr. Kelly Blodgett and his patient Jody Bolka. Good to have you both with us.
Thank you.
So, doctor, let me start with you. What is it exactly, and why should we be concerned about receding gums?
Great question. Well, when your roots get exposed, you have nerves underneath there that can be very sensitive, and the root surface itself can wear away a lot more quickly than the enamel of the tooth. So it can be an unsafe thing to have a lot of root exposure.
Right.
Most people might complain of like cold sensitivity or sensitivity to acidic foods, things like that.
Sure.
So Dr. Chao, who invented this pinhole gum rejuvenation technique, came up with a way, very minimally invasive surgical procedure to bring the gums over the roots without having to make incisions or do stitches, which is really great.
That's incredible. We're taking a looking at how it works. So and with no surgery?
Well, I mean, technically it's a surgical procedure,
right,
in that you're lifting the gums and moving them, but you don't, because you're literally making about a 2-millimeter pinhole to then come underneath the gums and move them gently over the roots.
Right.
You don't have to make all the incisions and then stitch it all back together, which was the solution that we had before.
The grafting kind of, right?
Yeah, and you know, it's understandable why so many people wouldn't choose to do that.
Right.
It's very uncomfortable and the healing process takes a long time.
Absolutely. Jody, tell me why you went to see the doctor, Dr. Blodgett. Like, what were you feeling in your mouth? What was bothering you?
Oh, well, I had some sensitivity
because
I had an exposed root above my canine tooth, and Dr. Blodgett talked about the pinhole procedure, and so I went with it, and it ended up being great. I had no discomfort post-procedure. It was very simple. I had no downtime.
We're taking a look at a picture, the before, so tell me, doctor, what we're seeing here.
Right, so the picture on the left shows where she had, we had put some veneers on the teeth and there was root that was exposed, and rather than making a veneer that was really long and kind of, you know, odd looking and unbalanced, we put the veneer right where we would want the edge of it to be and moved the gum over the root all at the same time, and then allowed Jody to heal up, which she did a great job of taking care of it. It reattached, and I mean, it was a very simple process.
How did you feel before and after?
Oh, easy.
Yeah.
I had no complications post-procedure.
And how do you feel now?
Great.
Yeah.
Great. I think it's been 4 years.
Wow.
And it still looks great, feels great, and the gum is still attached.
That's
to
great.
Yeah.
And let's take a look. You have a couple other patients that you did the same procedure on. And so tell me about this patient here.
Let's see, that looks like that may
Oh,
be
sorry,
Jody's.
here we
There
go.
we go.
Here we go.
Yeah, so that was actually an older gentleman who had driven up from Eugene. And you know, this is so common, right? You get the gold and porcelain fused to metal crowns on. Over time, you get recession. Those ugly edges start to show.
Right.
So rather than taking all those crowns off to get a better aesthetic result, we just moved the gums back to where they were originally, and they reattached, as you can see.
Does it take long? I mean, you said there's little to no downtime. So is everyone about the same in their reaction to it?
Well, you know, it can vary, right? So in Jody's case, we're literally dealing with the gum issue with one tooth. Sometimes we're talking, you know, the entire mouth for some patients. So certainly if you're doing more care at once, your recovery may be a little longer. But generally speaking, you're still able to eat most foods. You know, you want to avoid hard, crunchy things, but you can eat most salads and soups and things like that. You don't have the stitches to worry about in there.
That's so
yeah.
great. This is absolutely fantastic. Now, we want to tell folks, if they'd like to find out more about Chao Pinhole Gum Rejuvenation, we're going to put all the information for you on our website at katu.com. Thank you both very much. Appreciate it.
Thank you.
And you look beautiful.